From Washington, D.C. to the Central Coast, this is Focus with Farr, where our representative in Washington hosts in-depth discussions of important issues of the day. And now, Congressman Sam Farr.
Welcome to another segment of Focus with Farr. Today we're going to talk about an incredible decision made by the Supreme Court. That's on American health care policy, so-called Obamacare. And today I have some incredibly bright guests who have been in Congress longer than I have. One's a lawyer and the other's a doctor. They sit on the key committees and help shape that bill. And I can't wait to get you involved in talking to these wonderful congressmen. One from Seattle, Washington, Jim McDermott, a doctor who's on the Ways and Means Committee, knows more about health care than almost anybody in the United States Congress, was the author of the single payer plan, which was very popular in our state of California. In fact, visited our district out in the Central Coast in Santa Cruz for a town hall meeting on the single payer plan back in the mid-90s. And Rob Andrews, who's probably the most articulate person I've met in Congress on the whole intricacy of this very complex bill. Rob is from New Jersey. South Jersey is his so-called district. He's a lawyer. His wife is a lawyer. She's dean of a law school. He's been in Congress, again, longer than I have, I think since
1990.
90. Yeah. And is chair of the committee called Health, Employment, Labor, and
Pensions.
Pensions.
It's the acronym for HELP, which we try to do for our people.
And so I just thought, you know, we've had this decision. It was yesterday. I know this program is going to be running for months, so it's, you know, here we are in the week before 4th of July. What an incredible celebration for our country, because, I mean, how historical is this? I mean, Congress has been around for a long time and tried to help people. We've developed Medicare and so on. What is the significance of the law that we adopted?
The progressive platform of Theodore Roosevelt in 1910 had universal health care in it. So we tried for 102 years to get it done. Every president after him, practically speaking, tried, including Richard Nixon put a plan on the table. And we finally got something done in 2010 under President Obama. And then the forces against it really came out in full battle regalia and went after it. And we've been waiting for almost a year, more than a year, for the Supreme Court to come down with a decision. So what happened yesterday is enormous in terms of the social change in this country. It's something that should have happened many, many years ago, but
Sam,
well, Rob, you know the intricacies of this bill, and as Jim says, this is historically significant because it really is that final chapter in being able to get access to health care. You know more about the intricacies and problems of that access, and yet it's been, I think the whole bill's been slandered. I mean, there's so much misinformation out there and perpetuation of lies. What do you think is the biggest misstatement about this bill?
How much time do we have, Sam? Look, the worst misstatement that's going around now is it's a massive tax increase on middle-class people. That isn't true. The way this bill is paid for is really three ideas. First, what I consider to be corporate welfare, giveaways to health insurance companies in a program called Medicare Advantage, have been rolled back. Second, if a couple has an income of over about $400,000 a year, they pay very small surtax to pay for this bill. And then third, if someone who can afford health care—
That's an income that's filed as a joint—
Well, the adjusted gross income is $325,000, but to have an adjusted gross of $325,000, you probably have to have a gross over $400,000 normally. And then the third thing, you know, is the guy who makes $50,000 a year as a website designer, who decides to buy a motorcycle instead of buying health insurance and gets into an accident and goes to the emergency room and gets care, as he should. The question is, who do you think should pay his bill, him or you? And this bill says he should. that there is a penalty or tax imposed on him if he doesn't have health insurance. That's where the taxes are. And I assure you, a huge percentage of our viewers here are not going to pay any of those taxes.
And they've been paying that taxes, and
Sure.
to an extent, but
well, they've been paying the guy for the motorcycle's bill. You understand that?
Yes.
That when he gets hurt now and goes to the emergency room, the people
Without-
watching this program,
and having no insurance.
Yeah, with no insurance, the people watching this program pay his bill and their own. What this bill really does is say that people need to take responsibility for their own health insurance if they can afford it. If they can't, they go on Medicaid, or they get a very generous subsidy to help them afford it.
One of the things that you should know is that people are paying for it right now, as Rob says,
Absolutely.
by about $1,000 a year per person on their premium for their health insurance. Our premiums, those of us who pay premiums, are paying $1,000 a year more to cover those people who just show up in the emergency room.
for the uncompensated care, they show up, there's no way of collecting, and so therefore having to have insurance. And we use that term broadly because in this, can't you also have a health savings account which counts as your insurance policy?
You can.
So if you don't want to go out and buy something from some vendor of selling it, and all those insurances all have to be the same now, don't they? I mean, all the companies have to sell the same basic policy.
They have to meet certain minimums. For example, they can't cut your benefits off at any time in the year of your life because you get really sick the way they could before. They have to cover you if you have a pre-existing condition like breast cancer or asthma or diabetes. You know, they can't literally cancel your insurance because you need an operation or a procedure. We're not making these things up. These things happen across the country regularly, and those abuses are now against the laws. They should have been a long time ago.
It's really insurance reform to make sure that when you have a policy, you actually have something.
Right.
People thought they had a policy, and then something would happen to them, as in life. They'd get a cancer, and suddenly the insurance company would say, no, we're not covering that.
Here's another example, Sam, that I'm sure you hear about from your community. I hear it from mine. God forbid someone's son or daughter develops a drug or alcohol problem. And they find out, they thought they had coverage for that, but they find out that there's a $25,000 deductible, meaning they don't have any insurance until they pay the first 25 grand out of their pocket, or there's a $5,000 a year limit on the services. This bill says that the same deductible, same coverage you get for a knee operation, you would get if your son or daughter had a drug or alcohol problem or a mental health problem. For the first time, mental health and substance abuse is treated as a real illness. And you know, sadly, there's a lot of people watching this program for whom it's been a very real illness. And it's made them lose their home or lose their retirement or be unable to pay for college for their kids. So for the first time in this country, you know, the nightmare of a mental health problem or a drug or alcohol problem doesn't mean the end of someone's economic situation. This is a huge breakthrough to help people across racial lines, class lines, party lines.
Let me get back to the mandate, because I think that's what's stirring up so much people thinking, oh, the government's going to make me buy a health policy. There's not going to be a healthcare cop out there that's to examine every house, knocking on doors and saying, show me your healthcare policy. It really works by essentially when you have to pay that bill, right? I mean, how is it going to be paid for? And we're saying you've got to go out and buy insurance. We're going to make it very easy for you to buy insurance. You're going to be able to have competition among companies. They're all going to have to sell the same basic policy. So there's the competition. You can choose what you want. And if you just don't choose anything, go back to the
guy with the motorcycle.
Because I've had a town hall meeting where a guy said, go to hell, you know, I'm not buying any insurance. And everybody plotted, and then I said, and who's going to pay your bill? You are. And that's when they turned around and said, you know, sort of booed him. And so it's sort of, let's go back to that. What happens to that person who doesn't buy the insurance?
Well, let me use an analogy that people understand already. At least in Washington State, and I know in California, and I suspect in New Jersey, when you go down to get your license tabs, you have to show proof of insurance.
Yes.
If you can't show proof of an insurance policy
For your car.
Yeah, for your car, you don't get license tabs in the state of Washington. Yeah. And that's the same principle we're saying here, that everybody has to have insurance. And if at the end of the year when they send in their IRS and they don't staple their proof of insurance, they get a fine. They have to pay a penalty. That's how you're going to.
So it works just like the auto insurance.
It's just exactly
where you need the approval from government.
And we think it makes sense. Why should an uninsured driver be able to drive into my car and then just walk away and I'm stuck with the bill? That's what we're doing right now in healthcare. People don't have insurance for a lot of reasons. Some they can't afford it, but we are saying everybody has a civic responsibility to participate in the program at the level that they're capable of. And as Rob has said, there's all kinds of subsidies and ways we're going to help people.
Let's talk about 2 families and how this affects them. 3 families. Family making $30,000 a year with a couple of kids will be on Medicaid now, Medi-Cal in your case, which has almost no payment out of their pocket. A family making, say, $60,000 a year with a couple of children will have health insurance as good as yours or mine at a cost of about $40 or $50 a week in their premium. Now, that's not a small amount of money, but that's affordable for most people if they don't get it from their employer. But the guy with the $60,000 income with the motorcycle who opts to buy the motorcycle instead of buying health insurance will have to file his tax return. And if he doesn't have proof of insurance, just the way if you don't have proof of insurance and you go down for your driver's license, there will be a surtax imposed on him. And the reason is that your neighbor should not be paying your hospital bill if you could afford it but are not going to take the personal responsibility of buying health care. And
that surtax will be according to the income that is owed?
Pretty much, although it starts out as a flat fee of around $400 a year. It goes up to $600 or $700. I don't think it's frankly high enough, to be honest with you. But I think this idea that somebody who thinks they can live forever and can use the emergency room for free, can have their neighbors pay their bill, is irresponsible.
That's un-American.
I also think, listen, for the family that's raising a couple of children and trying to struggle to get by on $50,000 or $60,000 a year, there ought to be a very generous subsidy. And as I said a few minutes ago, for about $40 or $50 a week, that family will have health insurance as good as the 3 of us do. And that's what this bill accomplishes. And this is what would have been swept away if the conservative Tea Party people had had their way with the Supreme Court decision. I'm very glad that they didn't.
And what has really been a problem has been there's so much smoke and dust and mistruths and
Those
lies
are very polite
told.
terms. I would use a different term we can't use on the air.
That has been in the air. The people can't see that. Now, what happened yesterday was all that got taken away. Now people are going to see what it is really in this bill. And I think the American people are going to be very supportive.
Yeah, we have a website. I don't know if we're going to put it up, but the website is www.healthcare.gov. And as I understand it, the Secretary of Health and Human Services has put that website up for people to drill down as to their state and almost their county and figuring out what their own situation, as of the cases you've outlined here, and then showing them what's available in that jurisdiction under the new health care plan. I think that's going to help people when they understand, how does it affect me? Now, for people that are insured right now and have their public employees insurance or their private workplace insurance from their, how is that policy? Is that going to, that changes only in the fact that that policy now has to cover mental health? And
let me say this, for about 80% of people who are insured at work, nothing will change. For the
Say that again.
If you get your health insurance through work, if you work for the school district or the utility company or a manufacturer or a retail chain, and you get covered at work, for 80% of those people, nothing will change in their policy. For the 20% where something will change, here's what will change. If the policy says that, God forbid, your family's the one that gets a malignancy and runs out of benefits, you no longer can run out of benefits. There's no lifetime policy limit. Did you ever go to the supermarket and you see notices on the bulletin board for a beef and beer or a car wash or a golf tournament to benefit a family with a sick child?
Yeah.
Most of those families have health insurance, but they ran up against the lifetime policy limit because their kid had leukemia or brain cancer or something terrible like that. No more of that. Another change that would probably happen is that family might run into what's called an annual policy limit, where there's a certain number of dollars the insurance company will spend in a given year. Well, now, no matter what it costs in that year to take care of your child or your spouse, it gets covered. Another change would be that the amount that they can charge you out of pocket in a given year will be capped and limited depending upon your income. The typical family will be limited to no more than $7,000 or $8,000 a year at a maximum out of their pocket, co-pays, deductibles, and premiums. So this means if this is the unfortunate year when your child is diagnosed with leukemia and you get handed a $75,000 copay, you don't lose your house anymore. So if policies change, that's what they're going to change to. I think they should change to reflect that.
There's so much good in here. It's just it's outrageous that all we're hearing is all this negative.
Well, the insurance industry spent heavily to promote those negatives.
Yes.
And the other...
The whole idea of death panels, that came because there's a provision in there to pay doctors to spend some time to sit and talk with patients about how they want their life to end. If they have a heart attack or something bad happens in the hospital, what do they want the doctors to do? It's called final directives. And we put money in there so that the doctor would actually get paid to spend time with you to discuss that.
Well, I want to give the credit to Rob for putting that money in. We've discussed that. The three of us probably know more about that issue than anybody in Congress.
Well, I know you know a lot about it because of
wife
your family, your wife's exposure to this. And let me commend her and you for advocating so strongly for this. This is what this is about. This is about when a person is healthy and in good shape, being able to say, you know what, if anything ever happens to me, I want hospice care and I don't want my life artificially extended. They make the decision. Not the government, not the hospital, not an insurance company, not Medicare. They make the decision, not the doctor. The patient and the family makes the decision. You know, I've probably interacted with 1,000 people who have had loved ones in hospice care. 995 of them say it was a very positive experience. In addition to it being a positive experience, it saves the Medicare fund an enormous amount of money at end-of-life care. Again, it should be the patient's and family's decision. But as Jim said, when the person is healthy and well, why not let them go see their family doctor, have a serious, sober discussion about this, and pay the doctor for his or her time? That's the so-called death panel that has been so libeled and slandered in this bill. Well, you know, we have death panels now. They're called insurance companies that deprive people of transplants and operations for economic reasons. That's the real death panel. And those death panels were eliminated in this bill in favor of the kind of rights that we talked about.
So you really have a patient's rights here, a patient's for the first time in the history, this 100-year history of trying to give access to health care. I mean, access is always two things. It's, and I'm very keen on this because most of you know that my sister visiting me in the Peace Corps died on an operating table in a very rural hospital in Colombia when I was a Peace Corps volunteer. And it really struck me about had there been ability to have quality, I mean, care. It was, they didn't have x-ray machines, they didn't have anything. And you know, really taught me that access is both physical, geographical, having locality, but also accessibility as to affordability.
We continue to have our own version of that, tragically, here in the United States, that the heartache you suffered with your sister, that there are people today who aren't going to see a doctor when they feel a little off, when they have a pain in their stomach or they notice a lump somewhere in their body because they can't afford it. And you know, Jim's the doctor here and I'm a layperson, but I know enough to know this. Cancer that's not detected early is a lot more difficult to reverse than cancer that is detected early. How many people have lost a spouse or a parent or a sibling or a child because they couldn't take them to the doctor early on? 35 million Americans are now going to have insurance that lets them do that. What's that worth? What's that worth to this country? It's certainly worth, I think, the kind of investment that's being made here and the way we're doing it.
Well, the preventive care provisions of this bill are very important because it costs pennies to have somebody come in and take their blood pressure and find out that their blood pressure is elevated and put them on medication that will reduce it and prevent strokes. Now, what we do today is we don't do the prevention. We just leave you alone. When you have the stroke in the emergency room, then we'll spend thousands of dollars that could have been prevented if we had simply taken your blood pressure and put you on some medication to keep your blood pressure down.
And as Jim knows, because he helped to write this section of the law now changes and says that a hospital system, they're called accountable care organizations, that a hospital system that teaches people to get their blood pressure taken or uses telemedicine to do that will get paid more than a system that doesn't. The whole Medicare payment system.
So the education of the ounce of prevention, come
Yep.
here are all the things you can do, and it's paid for.
And the whole Medicare system is really shifting its payment from rewarding healthcare organizations for dealing with very sick people to rewarding them to get people
Keeping them
to
well.
prevent, to keep them well. Now listen, Medicare is certainly still going to pay for the surgery that's needed or the stroke care, but it's also going to pay for the education for the type 2 diabetic to check their blood sugar and eat better and exercise. It's going to pay for, you know, the kind of primary care visits and checkups that people ought to have to prevent a stroke or heart attack. We're investing in wellness rather than sickness here, and it breaks this model that's cost the country so much.
Well, both of you have been really champions in the debate for all the time that I've been in Congress, which is almost 20 years now. You've both been here longer than I have.
You're making us feel old, Sam. Stop
That's
it.
true.
What's your emotional feeling? I mean, this is a huge accomplishment for both of you. I mean, you're trained as a doctor and to give care all your life. You've been a incredible, outspoken advocate for health care, and Rob has been a champion for access to affordable care. I mean, it's not only his total involvement in his district and the law schools, and his wife's a dean, but I just, on his committee, how good do you feel about this?
Well, I gave my first speech for national health insurance in 1972 to the Young Democrats when I was running for governor in the state of Washington. So I've been waiting for a long time. And I got some messages yesterday with people who said, well, it finally happened. It's almost unbelievable in some ways because I was here when we tried with the Clintons, and it was blown out of the water with a bunch of untruths and all the rest of it. We never even took a vote on it finally. And the fact is that it happened. It says that, I guess the real message of it is that patience is a virtue. You got to keep pushing and pushing and pushing at what you believe, and ultimately, maybe you'll be there. I mean, the suffragettes, most of them never got to vote. Although they were pushing voting rights for women, they never, in fact, actually voted. But you got to push social change if you think it's the right thing. And I think giving people security around their health care is absolutely the one thing missing in our society.
What I thought of yesterday when I heard the decision, I was shopping last holiday season in a department store, and a lady who knew me in the district came up and said, listen, I'm really worried. I've been really sick lately. I'm coming to work anyway. And she's a single lady, maybe between the age of 55 and 60. Says, is there anything you can do to get me some health insurance? Because I looked at the price. It's going to cost me maybe $1,000, $1,500 a month. I can't afford it. I finally have an answer for her.
Yeah.
I finally have an answer. I can say to her, and by the way, I wish it were tomorrow morning, Sam, but it'll be January 1st, 2014. Here's your answer. For about 5% of her income, she will have a health insurance policy as good as yours or mine. That's the answer. I can finally look her in the eye and said, we did something about this. When the people from the Juvenile Diabetes Foundation come to Washington, I can finally say to them, no one is ever going to be to deny your son or daughter a health insurance policy or charge them more for it because they're diabetic. We did that. When a senior says to me, you know, I'm not putting my heat on in the winter, my air conditioning on in the summer because my prescriptions cost me so much, I can say, have you applied for your rebate yet? Can I help you get that $700 might help you? This is what was at stake in that court decision. This is what the other side wants to repeal. Yeah. You know, by the time this airs, they may have taken another couple of votes on repealing this bill. What planet are they living on? I mean, I just think that's what this is about.
And the cost of repeal, I mean, humongous savings in here for the federal government and for the private sector as well, because healthcare costs affect everybody. The private sector that's buying the insurance, the government that's buying insurance for their employees, and the government that's paying the benefits.
You know who pays the bills for uninsured people in this country? Insured people do.
Yeah.
So the people who will benefit from reducing the number of uninsured to zero, which this bill essentially does, is all of us who are fortunate enough to have health insurance. This doesn't just benefit uninsured people, it benefits everyone in our country. And the lies that have been told about this are, you know, look, they lied about Social Security and Roosevelt overcame it. They lied about Medicare and Johnson overcame it. They're lying about this, and we're going to overcome this.
Well, it's been a delight to have you on this program. We're going back for a break now, and I think you're going to be very busy in your district talking about it, and New Jersey's going to be very proud to have had you here and in the leadership in this bill. Any last words? We have about a minute left.
None, except I look forward to going home this time a lot more than I did last week, because it passed. I can say, as Rob says, we did it.
Yeah.
And there is a reason to believe that government is a place to find solutions to things we can't solve individually. We cannot solve healthcare individually. There's none of us, you and none of three of us are rich enough to handle what could happen to us in the next 15 minutes. But now we have a way.
What I would say, Sam, is thank you for being a steadfast and loyal and wise friend on this issue. You fought hard for it. You care about it in your heart. And we got this done because people didn't memorize charts and graphs or memorize bills. They understood in their heart who this bill helped, withstood the political pressure, and I'm proud that you're my friend and thankful you voted for this and supported it.
Well, thank you for being on this
Thank
program,
you.
Rob. Thank you, Jim. Jim McDermott, Rob Andrews, wonderful Congress members from Washington, state of Washington, from the state of New Jersey. Thank you for being on Focus with Farr. I hope you've enjoyed this half hour. This is an opportunity for you to see how things are working here in Washington. Join us next month for another Focus with Farr, and tell your friends about this program. And if you have any questions, feel free to call my office. Thank you for watching.
For more information, contact one of Congressman Farr's district offices. You can also reach Congressman Farr in Washington or visit his website.